Okay, let's unpack this. Chances are you're hearing it more and more, kids being diagnosed with conditions like, autism and ADHD.
Mm-hmm.
For many people, it feels like there's this huge, sometimes really overwhelming rise happening. Some experts even call it an epidemic.
Right.
And if you're a parent or maybe just trying to understand what's going on, it can be incredibly confusing.
It absolutely can. I mean, the sheer amount of information out there, different opinions flying around, and just the natural worry. It's a heavy load for anyone trying to figure it all out.
Totally. And that's exactly why we put together this deep dive, really, just for you. We've sifted through a whole stack of expert insights, research, powerful stories people shared, all from our source material. The goal, cut through some of that noise.
Yeah, our mission here is to look past just the labels, the symptoms you see on the surface. We want to try and understand what might be underneath all that, what's really happening inside the body.
Right.
And crucially, based on what the experts are finding, what are some simple practical steps you might be able to take?
It's really about finding some concrete hope, some actionable ideas that could actually make a difference. Ready to dive in?
Let's do it. Okay, so one of the first big topics that jumps out from the sources is autism. And there's just no denying the huge increase in diagnoses. Experts describe it as reaching, epidemic levels all over the world.
And you hear it all the time, oh, it's just genetic. But the experts we looked at, they really push back on that idea being the whole story.
They really do. The thing is, a purely genetic condition spreading that fast, it doesn't quite line up. It's less about just inheriting something directly and much more about how your genes interact with the world around you.
Like environmental factors, flipping switches.
Exactly. Switches. Think epigenetics, that layer above your genes that gets influenced by your lifestyle, your environment, all that stuff.
And what's really interesting is how these experts are talking about autism now. It's not just a behavioral thing, the social difficulties, the repetitive actions.
Right. They see those behaviors more as like outward signs of something deeper going on inside. They're increasingly framing autism as fundamentally a medical problem that has behavioral symptoms.
A medical problem.
Yeah.
Okay. So what kinds of things are happening inside the body then, according to these sources?
Well, the experts point to some key areas where things might be going wrong. Big issues with the gut microbiome, problems with how the immune system is responding, sometimes fundamental differences in brain structure or function, and often problems with the mitochondria. Those tiny energy factories in our cells maybe not working as well as they should.
So doctors who think this way, they're doing more than just observing behavior. They're running tests. What are they looking for?
Yeah, they are. They're testing for things like major imbalances in gut bacteria dysbiosis, or maybe an overgrowth of certain pathogens. They're looking at mitochondrial function, signs of inflammation throughout the body, that kind of thing.
Okay, and here's where it starts to sound really hopeful based on the stories and the findings we saw. When these underlying medical things are found and actually addressed, maybe one by one,
experts are reporting seeing really significant improvements, like kids starting to make better eye contact. Those really challenging behaviors might lessen or sometimes even stop altogether.
Wow.
Sleep often gets much better. Communication skills can start to emerge or improve. And of course, gut health improves too.
We came across this really powerful personal story. A parent noticed delays in her young son after they moved house. He was maybe 18 months old. Speech delays, some other things that made her worry about autism. And her first thought wasn't just, is this autism, but why did this happen? She started digging back, looking at her pregnancy, early life stuff, trying to find a cause.
And that search led her to think it wasn't just one single thing, right? Maybe some genetic vulnerability, meeting environmental toxins, and then lifestyle choices kind of influencing how those genes played out.
Exactly. And her deep dive wasn't just for her son, but also thinking about future pregnancies. They made huge lifestyle changes, organic food, cleaning up the home environment, avoiding plastics alongside the usual early interventions.
That story really highlights how broad the autism spectrum is too. It looks so different for every single child.
Yeah, from really subtle attention things to much bigger challenges with talking or sensory stuff or diet. And how it shows up definitely changes how you approach helping them.
Which leads a lot of experts to say, look for the low-hanging fruit first. What are the simpler things you can check for?
Like what?
Like, are there common nutrient deficiencies? What toxins might the child be exposed to regularly? And that big one, internal inflammation. The sources kept coming back to inflammation as a major driver.
And prevention came up a lot too. Experts saying this whole process can start even before getting pregnant, like 6 months before.
Yeah, the idea is for both parents to get their own health in the best possible shape. Make their home environment as clean as possible before even trying to conceive, because toxins stored in the parents' bodies can actually pass to the baby.
And keeping that low toxin environment going in the first few years is important too.
Seems to be key, yes. Then during pregnancy, the mom's health is obviously critical. Things like inflammation, certain infections, autoimmune issues in the mom, they're all linked to higher risk.
Right. Even looking at specific antibodies the mom might have and her nutrition, blood flow, all vital for the baby's brain. Even the dad's age, maybe over 40 or 45, was mentioned as a small factor.
And looking ahead, there's research trying to see if signs could be picked up even earlier, like during pregnancy, using things like advanced MRI or ultrasound to spot tiny brain differences. It's not for diagnosis now, but maybe someday for earlier identification.
But right now, diagnosis often happens later, right? Like age 3 or older, sometimes.
Unfortunately, yes. And the experts are unanimous. The sooner kids get the right kind of support and intervention, the better the chance for really big improvements. They really urge parents not to ignore those early signs, speech delays, major behavior changes.
And coming back to the symptoms like being nonverbal or having intense anxiety or those repetitive movements, stims.
Yeah, the experts really stress that these aren't just, quirks to accept. They're often signals. Signals that the child is uncomfortable, maybe in distress, or that something inside isn't working right.
And one area that kept coming up again and again in the sources as being foundational to a lot of these symptoms, the gut.
Absolutely. That gut-brain connection, the gut-immune connection, it's incredibly strong.
So what kind of gut problems are common?
Well, things like that imbalance of good and bad bacteria dysbiosis, increased gut permeability, what people call leaky gut, and just chronic inflammation in the digestive system itself.
The numbers mentioned were pretty striking. Experts saying maybe 70 or 80% of kids with autism have significant gut issues compared to much less, like 10 to 40% other kids.
Yeah, it's a really high correlation. And what's fascinating is how gut function can link to things like mood or even movement. Did you know most of your serotonin, the happy chemical, is actually made in your gut?
I didn't realize it was most of it.
Yeah. And serotonin also helps your gut move things along. So if serotonin is low, it can contribute to constipation. Sometimes constipation isn't just about fiber. It might be partly a neurotransmitter thing starting in the gut.
Wow. There was this incredibly moving story we heard about that connection. A nonverbal child with autism suffered terribly with belly pain, always holding her stomach, had chronic diarrhea.
Oh, that's heartbreaking.
Doctors finally figured out she had Crohn's disease, a serious inflammatory bowel condition, and when they treated the Crohn's medically, she started to talk.
That's amazing. It just shows how deeply connected gut health can be to communication and behavior, at least in some kids.
Right. And beyond the gut, experts also look into things like how the body uses certain vitamins, like B vitamins methylation, it's called.
At the methylation pathways.
Yeah.
And food allergies or sensitivities, autoimmunity, where the body kind of attacks itself. Fixing these things can really help reduce symptoms.
Okay, so speaking of food, what specific foods did the experts really point fingers at?
Consistently, the top two that came up again and again as causing gut inflammation were gluten and dairy.
Gluten and dairy. But here's the weird part. Experts said these are often the foods kids on the spectrum crave the most.
Yeah, it seems totally backwards, doesn't it?
Why would they crave stuff that's bad for them?
Well, the theory experts shared is that when gluten and dairy break down, they create these compounds. Casomorphins from dairy, gliadorphins from gluten, that can act almost like tiny opioids or pain relievers in the brain. They hit the reward system.
So it gives them a temporary good feeling, maybe.
Potentially, yes. A temporary comfort or reward, which drives the craving. But at the same time, these foods are causing significant inflammation, not just in the gut, but in the brain too.
And brain inflammation. What does that look like on the outside? How would you know?
It can show up as what people often call brain fog. Both gluten and dairy contain glutamate. For some sensitive kids, that glutamate can build up and act like an excitotoxin in the brain, kind of overstimulating things.
So it messes with thinking, learning.
Exactly. Interferes with clear thinking, learning, focus, even speech.
We heard this incredible story from one family. They took gluten and dairy out of their child's diet and saw what they called almost a complete reversal of the autism symptoms.
Wow, a complete reversal.
Almost. And the proof for them was later the child accidentally ate gluten and dairy and the symptoms came flooding back for about a week. That convinced them.
Those kinds of stories really underline what so many experts are saying. Diet is priority number one. It's seen as the most important foundational step a parent can take.
So many kids with autism just don't handle processed foods well.
Seems that way. And gluten and dairy are often flagged as must-avoids by many practitioners because of that brain inflammation they can trigger, which directly impacts learning and speech. Cleaning up the gut, reducing toxins, also seen as essential.
It sounds like these kids are almost like super sensitive indicators for our modern world.
That's a great analogy. Canaries in the coal mine. Things that maybe don't bother you or me much can have a massive impact on them. So getting that gut inflammation down, especially by removing gluten and dairy, is key, according to many experts. They also dig into gut bacteria and environmental toxins.
And dealing with toxins, how do you even start with that? Seems huge.
Well, part of it is reducing exposure, obviously, but you also need to support the body's own detox systems. Simple stuff, like making sure they drink enough clean water. And nutrition is huge. Lots of green leafy vegetables.
Even if you have to hide them in smoothies.
Whatever works. Smoothies, muffins. Get those greens in. Certain supplements called binders can also help grab onto toxins in the gut and carry them out. And supporting the liver and kidneys, the body's filters, is important.
And don't forget looking for hidden stuff like mold in the house. Some experts mention that as a potential trigger.
Oh, absolutely. Mold and mycotoxins. That can be a big piece of the puzzle for some kids. It might take some detective work, special testing, but clearing those exposures can sometimes lead to dramatic turnarounds.
Okay, let's shift gears a bit. What about ADHD? That's even more common, right? And also increasing.
Yes, ADHD diagnoses are even more prevalent than autism and also seeing a significant rise.
So where does ADHD come from based on this deep dive? Genetics again.
Genetics definitely plays a big role. Lots of research suggests a predisposition, maybe up to 80%.
But, like autism, genes aren't the whole story. It's not destiny.
Absolutely not. Again, it's that gene-environment interaction, what switches those genes on. Factors that came up include mom's nutrition during pregnancy, things like folate, vitamin D, and exposure to neurotoxins like certain pesticides or lead.
And here's something specific I found really interesting. Studies showing kids with ADHD often have low iron stores, low ferritin levels.
Yes, that connection is quite consistent. And even more, lower ferritin often correlates with more severe ADHD symptoms.
Wow, okay. And diet. Is that as big a factor in ADHD as it seems to be in autism?
Huge EE.
Yeah.
Diet is flagged as a major contributor to ADHD symptoms too. Inattention, restlessness, impulsivity, the specific things mentioned. Artificial food dyes, gluten, dairy, and especially sugar.
Okay, let's talk sugar. Why is sugar such a big problem for kids with ADHD-like symptoms?
Well, first, sugar causes inflammation, like we discussed. But maybe even more directly, it sends blood sugar on a roller coaster.
Right.
Kid eats sugar, blood sugar spikes, they get that burst of restless energy, maybe can't sit still. Then the body overreacts, insulin floods in, and blood sugar crashes.
And the crash makes them
Anxious, moody, irritable, unable to focus. That constant up and down, that blood sugar wave, can look exactly like classic ADHD symptoms. So sometimes it might be more of a blood sugar issue or a food reaction than purely a brain chemical thing.
Makes sense. What about other environmental things besides diet?
Movement and screen time. Huge factors mentioned repeatedly. Think about it. Kids sit still all day at school, then maybe go home to more screens. All that natural energy gets bottled up.
So exercise helps.
Massively. Exercise is actually a well-researched treatment for ADHD symptoms. It helps release that energy, improves focus, helps regulate things. Getting outside is key. And too much screen time. Linked to shorter attention spans, less ability to connect.
How parents talk to their kids about an ADHD diagnosis. That seems tricky.
It's definitely personal. The sources acknowledge that, suggest talking to a therapist if needed. It really depends on the child, the family.
One idea that came up was reframing it, not as something wrong with them, but maybe like a superpower if they learn to manage it.
Exactly. Someone used the analogy. A brain like a Ferrari, but the brakes don't work so well. It acknowledges the potential, the speed, the hyperfocus on passions, but also the challenge with regulation.
And that ties into looking for the why before jumping to conclusions or medication, right?
Yes. Experts and families shared stories where addressing underlying issues Diet, deficiencies, inflammation led to such big improvements that the child didn't even meet the diagnostic criteria anymore.
So the message isn't that ADHD isn't real.
Not at all. It's very real for many. But lifestyle changes can drastically reduce the symptoms and address what's actually causing or worsening them.
And that's where the hope lies, right? Symptoms can be reduced naturally. Medication is a tool, maybe, but not the only way.
Absolutely. Families are finding ways for kids to thrive by digging into these root causes. It often starts with just listening to the child's body. Frequent tantrums, inability to sit still. Maybe it's not defiance. Maybe they're physically uncomfortable. Maybe it's inflammation.
So for hyperactivity, maybe don't reach for meds first.
According to many experts, no. Look at diet first. Look at life stress. Mental health symptoms, including hyperactivity and anxiety, often respond incredibly well to nutrition changes, targeted supplements, and teaching kids self-regulation skills.
How do you start tackling that inflammation piece for ADHD?
Diet is ground zero. Get the inflammatory stuff out, gluten, dairy, soy, artificial colors, flavors, all that excess sugar, and flood the body with the good stuff, fruits, veggies, healthy fats.
Which healthy fats?
Things like avocado, coconut oil, olive oil, and really importantly, avoiding those industrial seed oils like vegetable oil, canola, safflower oil. Those are highly inflammatory. Plus, lean protein, clean water.
And cleaning up the home environment too?
Yes, reducing toxins. Think heavy metals in old water pipes, pesticides on food, chemicals in soaps and lotions, making home a safe zone.
And helping the body detox, like with autism.
Same idea. Lots of greens. Get them in however you can. Maybe binders if needed, supporting the liver and kidneys.
Exercise came up as actually being researched as a treatment.
Yes. Highly studied and effective. Get kids moving. Outside, preferably. It helps process stress, helps detox pathways, reduces inflammation, and directly helps brain function, focus, impulse control. Experts really think schools need way more movement breaks.
And sunshine. Vitamin D.
Simple but crucial. Good for mood, immune function, overall health.
I liked the analogy one expert used. Helping a child thrive is like baking a pie. Diet is the crust.
The foundation, yeah.
Yeah.
Non-negotiable.
But you need other ingredients too. What else?
Good sleep is huge. Check for mouth breathing could be sleep apnea, which tanks focus. Needs a doctor's look.
Okay.
Then there's the parent-child connection. Staying calm yourself helps regulate them. Teaching conscious breathing, simple but powerful for getting oxygen to the brain and calming down. And again, less screen time. Big impact on focus and connection.
There was an interesting link made between allergies and ADHD. What's the connection there?
Inflammation is the common link. If a kid has allergies, their immune system is overreacting, creating inflammation. That inflammation doesn't just stay in the nose or skin. It can affect the brain too.
Ah, neuroinflammation.
Exactly. So calming down that overall inflammation with things like omega-3s and vitamin D can often help both the allergies and the ADHD symptoms.
We heard a great story about that. A young boy, maybe 7 or 8, allergies, eczema, anxiety, some depression. Parents wanted natural options.
Right.
They did gut testing, used probiotics, found high inflammation, imbalanced omega fats, so they added omega-3s, specific B vitamins, magnesium.
And the result?
The mom said within a couple of weeks, he was just a different child. The difficult behaviors, the anxiety, it was likely just him being physically uncomfortable but unable to say it.
That really drives it home. Diet is the foundation.
Yeah.
For everyone, but especially these sensitive kids. Get the inflammatory stuff out, gluten, dairy, soy, artificial junk, excess sugar. Build meals around whole foods, healthy fats, lean protein, clean water.
And practically experts say you don't have to do it all at once, right?
No, absolutely not. Start small. Pick one meal, maybe breakfast. Focus on healthy fats, good carbs, and especially protein. So many kids aren't getting enough protein for their brains to build neurotransmitters properly. And variety is key for getting all the nutrients.
What other ingredients for the pie were mentioned? Other therapies?
Things like chiropractic care came up, neurofeedback, that's brain training basically, parent coaching, play therapy, mindfulness, or meditation.
Mindfulness for kids.
Yeah, even starting super small, like 5 minutes a day. It gives them a tool for life, helps them manage stress and regulate themselves.
We also heard from an expert diagnosed with ADHD as an adult. She reframed it as a superpower once she understood it.
Yeah, that was inspiring. And now she helps kids naturally, focusing hard on inflammation, diet, and getting enough essential amino acids, the building blocks for brain chemicals. She really stressed that lack of protein in kids' diets. And avoiding refined sugar, seed oils, food dyes, non-negotiable for her.
And there's hope even for picky eaters.
Definitely. Kids are adaptable. It takes time, patience, and the whole family modeling it, but they can learn to prefer healthy foods. We even heard about teenagers choosing healthy lifestyles and influencing their friends.
So after all this talk about diet and lifestyle, where does medication fit in? What did the sources say?
The consistent message was, medication is a tool. It's an option, but it's not the only answer, and it's not the right path for every child or family.
There was that clinic story, a 9-year-old boy, big mood swings.
Right. And with lifestyle changes, plus a specific supplement, L-tyrosine, his mood stabilized dramatically. No other meds needed for that.
So it reinforces that point. If kids make these changes, address the underlying stuff.
They can often use less medication, or maybe none at all. Exercise, nutrition, learning to manage their own brain and body. These are powerful interventions.
A parent shared a very personal story about her son, diagnosed with ADHD at 8. She talked about how learning to understand his brain and speak up for his needs at school was huge for him.
Empowering him, yeah.
Yeah.
Helping kids see they aren't broken, just different.
She also reflected on her own stress during pregnancy after previous losses, wondering how that might have impacted her son, who was always very sensitive. She described being incredibly strict early on sleep schedule, clean diet, no gluten, dairy, sugar for years, no screens until age 5, feeling he needed intense external support.
Because he was so sensitive to everything.
Yeah. And she talked about how school was tough initially. He felt wrong, like a failure, because things were harder for him. He was working so much harder than other kids, getting exhausted.
And then sometimes stimulants get prescribed for that fatigue without looking at why they're so tired.
Exactly. But her son's story has a hopeful turn. He did embrace healthy habits later. And then in high school, he decided, with information and support, to try medication. He found something that worked for him when he felt he needed it.
So it became his choice, his agency.
Right. And finding a passion sailing, in his case, that used his energy and built confidence was also key. It wasn't just one thing.
That's such an important point. Then there was that other clinic story, the family with 3 boys, 2 ADHD, 1 autism, before they made changes.
32 school suspensions in 1 year for the 2 boys with ADHD. 32.
Just staggering. But then, after implementing changes, diet, lifestyle, addressing health issues.
0 suspensions the next year. 0. They were winning awards, doing well in school. The family called it going from absolute pain to absolute joy.
Wow. Stories like that, and the fact that many practitioners in this field are parents who went through this themselves and now help others. It shows the potential.
It really does. It weaves together this message of hope. Don't just stick a label on a child and make them feel less than. Shift the focus to action, understanding the why and changing the lifestyle to support their health.
So just to wrap it up simply, this rise in autism and ADHD, experts are often linking it to hidden medical stuff inside the body, gut issues, inflammation, toxins, not just genes or behavior.
And the really encouraging part is that simple, powerful lifestyle changes, especially diet as the foundation, cleaning up the environment, supporting the body, can make a massive difference. Reduce symptoms, help kids really flourish.
Absolutely. The stories show big improvements are possible. There's real hope here. Medication is one tool, sure, but tackling root causes often comes first and can be incredibly powerful.
Experts suggest there are lots of resources out there if you want to learn more simple steps, healthy cooking ideas, detox tips, personalized guides for your family.
Which brings us to you listening. Now it's your turn. After hearing all this, what piece of information kind of surprised you? Or maybe what's one simple step you're thinking you might explore for your family?
We'd love to hear from you. Show your thoughts, your experiences, any questions you have in the comments section below. Let us know what you think.